So these are some of the most commonly asked questions I get, and I've been thinking a lot about how to answer this question because everyone kind of wants simple answers to everything, and there's not always a simple answer for things. Yes, Invisalign does work great, but can it work for every single case? No, not necessarily, and it's important to understand the pros and cons of when it can and when it can't. Does every child need phase one? No, absolutely not. But there are some that do, and some kids need to get it twice. It's important to understand when all of this comes into play. You know, in orthodontics, they have a lot of swings one way or the other, where everyone starts to do phase one, or everyone's only wanting to use Invisalign, or so on and so forth. And when we get into these boxes where we're trying to put everyone into one box, then it doesn't work. That's why it's really important to evaluate each individual, study the case, see how things look like, so that you're making decisions based on what you see in the patient. Sometimes there's multiple options, and it's important to be able to evaluate that and give the best options to your patients, and not just make everyone fit into what you think is best, and be able to explain all of it. So we do phase one, we do Invisalign, we do use braces, we do extractions, we do use expanders, we do use myofunctional therapy, but it's different for each patient. That's what that exam is for. That's why we spend an hour, we spend time, we make sure we study the case. Even after we finish diagnosing the case, once we've scanned the patient's teeth, Dr. Abed and I sit down and we review our cases and go over the treatments to make sure that we're always doing the right treatment for all the patients. And I think that's really what it comes down to, is making sure that you're doing what's best for your patient and not just trying to have them fit into a certain mold. And that's really what we're all about.